A mammogram can cause discomfort due to the compression. It varies from patient to patient, and most women tolerate the exam quite well. Myth. At current doses, it's almost impossible to cause cancer. Modern equipment has dosimeters, knowing with certainty the dose that each patient received in their mammographic study. In addition, modern digital mammography equipment has reduced its doses in a range of 30 to 40%, depending on breast volume.
Myth. We all have lymph node in the armpit. As part of our normal immune system, the lymph node under your arm are often the first site to which breast cancer may spread. This is the reason why axillary ultrasound is crucial in the radiological evaluation, helping to establish the stage of breast disease, identifying abnormal lymph node and eventually changing the treatment. On that note, I would like to remember all women the significant benefit of screening mammography, because the majority of breast cancer detected in screening mammography are at early stage with no lymph node involvement. So let's screening. Myth. There is no evidence that a biopsy can spread the disease. Breast biopsy is an absolutely necessary procedure to obtain diagnosis and plan the treatment. It's a safe procedure where the radiologists obtain a small amount of tissue to be tested.
Fact. All patients are followed up with mammographic and ultrasound control of the breast after finishing treatment, first at 6 months and then every 12 months. Fact. Dense breast tissue can make it more challenging to detect cancer on a mammogram, and also dense breast tissue is associated with an increased risk of developing breast cancer.
It's indeed a fact. Almost all patients treated for breast cancer report pain at some point. This is because of changes in sensitivity caused by surgery and radiotherapy. There are painkillers and aesthetic creams that can help you to manage this complaint. Myth. That's not always true. The axillary surgery is not necessary in some situations, such as elderly patients with early-stage hormone-positive breast cancer or breast lesions with only an in situ component. You can get more information from a breast cancer surgeon.
It's a myth. In fact, we use less and less chemotherapy. So we oncologists based our decision mostly in 3 criteria. The type of breast cancer. We know the vast majority are hormonal dependent breast cancer, meaning they are estrogen driven. But then we have the HER2 breast cancer, which is a protein with USS in the tumor that associates with more aggressive types of breast cancer. And then we have those that are not hormonal dependent and are also HER2 negative, that we call triple negative, that are very or quite more uncommon. And so that's one. And the different types of breast cancer do have different types of treatment. The second one is the stage, and that's why it's so important the screening to detect these cancers as early as possible. And the last one, for the vast majority of tumors, the hormonal dependent breast cancers, the 70% of them, we have now genomic platforms. And this has nothing to do with the BRCA Jolie genes. These are genes that we assess within the tumor and predict us the risk of relapse and the benefit of chemotherapy. That is true. Obviously, the risk of a recurrence can be extremely low, can be intermediate, or can be high. Nevertheless, what is important is that beyond oncologic treatments recommended by your team of experts, you also know what you can do to reduce your own risk of relapse. One is a healthy Mediterranean diet, and the second one, that is even more important, is a regular and consistent physical activity. Not only it reduces the risk of relapse, it also reduces the risk of cardiovascular diseases and improves the tolerance of the treatments. It improves your bone health, reduces the hot flashes, reduces anxiety. And so all of this is important, not only for cancer, but also for your quality of life.
Myth. Nowadays, radiotherapy techniques have evolved in such a way that we are able to concentrate the dose in the breast, significantly reducing the dose to surrounding organs such as the lung or the heart. In addition, we have special techniques that allow us to separate the heart from the breast through breathing control, and this lets us to limit the dose to the heart even more. Moreover, prior to the administration of the treatment, we perform an imaging test to verify that the positioning is the same as planned, so that we can administer the radiation accurately and safely. Myth. External radiotherapy uses ionizing radiation similar to ultraviolet radiation or X-rays. We do not use radioactive elements. Therefore, the patient can lead an absolutely normal life for the entire duration of the treatment. Patients in the course of a radiotherapy treatment can be in contact with children and elderly people without any risk for them. Radiotherapy treatment is safe for you and your family.